Hi, I'm Lizzie, and today I'm going to be talking a little bit about right hemisphere dysfunction. So as we have discussed in class, language has historically been accepted to be localized within the left hemisphere. And this localization was identified in the late 1860s by neurologists Paul Broca and Carl Wernicke. And they identified aphasia as a distinct language disorder resulting from a left hemisphere lesion. And so for them, communication is language, and language is what makes us human. And this was a really powerful notion, and as a result, the left hemisphere became known as the dominant hemisphere, and the right hemisphere was referred to as the silent or quiet hemisphere. Over time, the right hemisphere was given more attention with regards to visuospatial processing, but it was still generally thought to be basically irrelevant to human communication. So it wasn't until the 1860s that this notion began to change, and it was during this time that a revolutionary new surgery was being done to treat severe epilepsy. And as we've learned, the corpus callosum is an important group of fibers that connects the left and right hemispheres, and this surgery involved severing the corpus callosum so that unwanted brain activity wouldn't be transferred from one hemisphere to another, and therefore, hopefully, these severe epileptic seizures would be reduced. And then, as a result of this, a new branch of research stemmed from studies of these patients, and it was known as split brain research because these patients were referred to as having a split brain. And this really opened up the concept of laterality to the research world, and the view of the right hemisphere really began to change, because from this they found that the right hemisphere was actually able to decode simple linguistic forms and sort of discourse level language. So now we know that the right hemisphere is important for the gestalt, or the big picture aspect of communication. So while the left hemisphere is dominant for the rule-based aspect of language, the right is dominant for this fluidity and flexibility aspect of language and communication. So now a general description of the two hemispheres that is accepted today is that the left hemisphere is rational and sequential, detail-oriented, it assesses cause and effect, oriented to the past and future, it controls the right side of the body, attends to the right visual space, and it attends to the rule-based aspect of language. On the other hand, the right side of the brain is intuitive and simultaneous, has parallel processing. It assesses the present. It's analytic. It controls the left side of the body and the left visual space. It attends to the left visual space. And it attends to the prosody and pragmatic and discourse aspects of language. So, if someone suffers from right hemisphere damage, will that have an effect on their communication? And the answer is yes. Definitely. There are a variety of symptoms that can occur as a result of right hemisphere damage, and they may occur independently or in any combination. So the symptoms that we, as speech-language pathologists, would be concerned with include cognitive impairments, so that would be attention, memory, and executive functioning, as well as language impairments, and that would be both receptive and expressive language. So as far as the cognitive symptoms, a patient may suffer from a short attention span, and that would be like a difficulty with vigilance. So, for example, they may no longer be able to sit down and read a book because they can't focus for long enough before they just move on to something else. And this is referred to as sustained attention, which generally corresponds to damage in the right prefrontal cortex. They may also be easily distractible, which could make it difficult for them to carry on a conversation appropriately because they keep being distracted by external or even internal stimuli. And as we learned, this could be due to damage in any of the areas that are associated with the selective attention network, so the posterior parietal cortex, the dorsolateral prefrontal cortex, and the anterior cingulate cortex. And of course, they may also have difficulty attending to the left visual hemispace. Memory is something that is generally spared, but there may be some confabulation, which is making up something that didn't happen, but they think they're actually telling the truth. So they might not remember something, it's not in their memory, but they fill it in themselves with something that they think happened. And they do this subconsciously. Generally, the right frontal lobe is damaged with right hemisphere dysfunction, and this will result in some executive dysfunction. This means that a person might have difficulty with concrete problem solving and decision making. They may exhibit poor planning and inhibition, and they could also have anosognosia, which is poor awareness of their limitations. As for the receptive communication deficits, a person with right hemisphere dysfunction will likely have difficulty understanding abstract language, like idioms or ambiguous language. So, for example, they could have trouble interpreting an indirect hint that someone might say, oh, it's really chilly in here, or they put a sweater on, and that would mean to someone that they should turn the heat on. But someone with right hemisphere dysfunction, that might just go right over their head. They will also have trouble reading body language and comprehending sarcasm, because that relies on prosody. The expressive communication deficits could be that they have a flat affect, so that's it's described as an unlikable face, because they don't show any emotion on their face. Also a monotone voice with no little prosody variations, little facial expression, poor pragmatics, which is sort of a direct result of the flat affect, as well as poor pragmatics in discourse. And then their discourse tends to be tangential, and spontaneous language can be difficult. So generative and creative language is much more of a problem. They could also use rote expressions, like saying happy birthday at inappropriate times, because it's something that's rote to most of us. And they could also suffer from something called logorrhea, which is verbosity, so using many more words than is needed or appropriate. So those are the general symptoms of someone suffering from right hemisphere dysfunction. The causes are varied, but it could be a brain tumor or encephalitis, but the most common cause is stroke, either thrombosis, embolism, or hemorrhage. And the main arteries of the brain that could cause right hemisphere dysfunction is the anterior supply from the internal carotid, the posterior supply from the vertebral arteries, and then the circle of Willis, so the communication arteries. In general, right hemisphere damage as a result of TBI is also a possible cause of these types of symptoms, but that tends to be more diffuse than a focal lesion like a stroke or a gunshot wound or something like that. So while symptoms can be localized to a particular part of the right hemisphere, like the attention deficits, there's still a lot that's unknown about right hemisphere communication damage, especially because research in this area has only been around for about 25 years. So why do these deficits really matter to speech-language pathologists? We are concerned with anything that affects someone's ability to functionally communicate and participate fully in society. And so if we think about the symptoms, they can really have a negative effect on discourse and relationships. According to ASHA's position statement on the role of the SLP in cognitive communicative disorders, the cognitive communication disorders encompass difficulty with any aspect of communication that is affected by disruption of cognition. And given the potentially serious consequences, including negative impact on social, academic, and vocational success, on quality of life, appropriate preventative efforts, assessment, diagnosis, and management are critical, and these are done by the SLP. So what can we do to help? There are a variety of different treatments that would be appropriate, and a clinician would start with whatever is most detrimental to that individual's communicative interactions, and I'm just going to go over a few of them. For someone with attention deficits, there's an evidence-based treatment called attention process training, which is basically just the idea that neurons that fire together wire together, so you just keep practicing attention, like maybe doing math problems just for a long period of time, or doing problems with distracting beeps in the background. You just practice it over and over until you're better at it. As far as discourse training, you could teach a client compensatory strategies and support systems. Those with right hemisphere dysfunction tend to benefit a lot from the contextual clues, explicit main ideas, and redundancy. So if they're becoming lost in a conversation, they can tell their conversation partner to stop, to back up, be more clear. Caregivers can be trained in a similar way to use strategies like that to speak to their loved one and lower the cognitive demand on their part. Pragmatics can also be targeted. A goal could be turn-taking or even strategies for inhibition. There's also some strategies for teaching awareness, like using charts or keeping diaries about how someone's performance is and how it's improving. And one last treatment I'll mention is you could also work on executive function skills. So you could teach steps to go through for any difficult problem or even any small problem. And that would be to stop, to consider all of the possible solutions, think of pros and cons for each one, pick the best one, and then review the process. And for all of these treatments, the clinician's role would be to support fully so that the client is successful, and then to gradually fade the cues until the client is able to independently communicate. So, that's it.